Calls are mounting for President Cyril Ramaphosa to end the national state of disaster. It was introduced, you'll remember, in March 2020 in response to the COVID-19 pandemic. The latest extension is set to lapse on Saturday, but scientists say it's no longer necessary. Meanwhile, some politicians argue now is undermining our democracy. To weigh in on this, we're joined by Dr. Fareed Abdullah, an infectious diseases clinician at Steve Biko Academic Hospital. Many thanks for your time this afternoon, Doc. And I'm just wondering your thoughts in terms of the engagements that you've had with your colleagues around this matter. Would it be an opportune time for South Africa to lift that national state of disaster?
Rofhiwa, thank you for having me. To ease into this discussion, what we've been saying, my colleagues and I, is that government is headed in the right direction, in that we've reached a point now where there is so much background immunity from prior infection and vaccination that our management of this epidemic needs to change quite a bit. And in that regard, you know, the government did the correct thing by not introducing a lockdown. I think people have such short memories and have forgotten that whenever the wave started, there were these horrendous lockdowns which shut down so many things. And for the fourth wave, you know, government decided to be bold and take a different approach. Now that set it on a different path. From a medical point of view, we are saying that the case rates are high during these waves, but the death rates are low, and that allows us to make some changes. So we should change the way we do contact tracing, quarantining people who have contact with cases, and also reduce isolation. We should also start thinking about just relaxing a little bit our hand hygiene, thermal screening. These things, you know, were relevant in previous waves, but we've reached a point now where all of this changes. But to answer your question, it's certainly, you know, the next logical step is to bring an end to this national state of disaster. And from what I understand, there are a couple of things which need to be continued to be in place. For instance, it's the state of disaster regulations, which allows for the social relief of distress grants, right? So, you know, the mechanisms need to be put in place in the Department of Social Development for that. But from a medical point of view, it seems that it will make more sense if the future kind of regulations to manage this pandemic arise out of the National Health Act and are managed by the National Department of Health. So we would support going in that direction, but to make sure that, you know, everything is in place before we just dump these regulations.
Do you not fear that there might be some hesitation from national authorities, Doc? You'll remember in December, the protocols around quarantine periods and so were amended, and then a few days later, they were taken back to the original ones. So are there no concerns that there might be a little bit of hesitation from national health authorities in terms of making a decisive decision on our way forward as we manage the pandemic?
So in fact, that is the perfect example of how, you know, we're kind of getting tripped up between departments, because it's my understanding that my colleagues in the National Department of Health, backed by the scientists, you know, do want to make these changes, as was done in the notices that were issued, but they had to be withdrawn because that then fell foul of the national disaster regulations. And when you have so many sets of regulations, you know, it's better, I think, to claw back the control of this pandemic to the health people who I think should be in the lead. And that's the example of exactly how these things go wrong when you have, you know, such a highly regulated environment. We need regulation. We need the health department to be able to, you know, create, if there's a change, to create certain controls, public health controls, and implement measures. who knows what will come up in the next few months. But we think that it's probably time for those regulations to be managed under the National Health Act and to put those in place and to move on from these disaster regulations.
And if we move on from those disaster regulations, Doc, are you confident that our health systems have changed or developed sufficient ways in which to manage COVID-19 going forward?
I think with or without the disaster regulations, the health system has to do what it has to do. So I don't think those two things are linked. Our health system has got many weaknesses. It's struggling a lot, especially in the public sector. But I do think that we've learned a lot from previous waves. The fourth wave was a lot less severe than previous waves. So I do think that, that link sort of has been broken now. To expand upon that, as the Western Cape data has shown, in the past, the lockdowns, the highly regulated environment was to, control of alcohol, for instance, was there to prevent trauma cases, to free up ICU beds for COVID-19. We have reached a situation in the fourth wave where, the health system was able to accommodate both the trauma cases and the COVID-19 ICU cases. And that's all part of understanding that we're moving away from this epidemic phase of COVID-19 to what we're calling the endemic phase. So we must adapt our response, adapt our behavior to the new situation.
And of course, the vaccination drive throughout the country is going to be something that's going to be very important so that we can return to some kind of normalcy as we learn to live with the pandemic. Dr. Fareed Abdullah, an infectious diseases clinician at Steve Biko Academic Hospital, many thanks for giving us your insights on giving up the national state of disaster.